Hi everybody, welcome to this session where I'm going to talk about, I've jumped quite a bit, using technology to support a personalised approach to wellbeing. I know I'm standing between you and lunch, so I'll try and get through it as quickly as possible. If you've got any questions, you can either use the app or I'll be at the Cigna stand over lunchtime, so you can come and ask me there. I'm Catherine O'Connell. I'm Head of Occupational Health and Safety at Standard Life Aberdeen. I've been with the company 14 years. So who are Standard Life Aberdeen? Well, that's a new name as of August last year. So it was created with a merger between Standard Life and Aberdeen Asset Management. We operate in 50 locations globally. We're a global investment company and we employ over 9,000 employees. Just to be clear, that we haven't merged the terms and conditions for both companies yet, so I'm talking about the Standard Life journey and where we are on that. So I want to take you through why it's important at this time to think about digital and using that, how to integrate it with your healthcare plan, and a little bit of a case study. I'll walk you through our journey of using the app. So why is it time to take action? We've got an ageing population, which means an ageing workforce. There's an increase in chronic conditions, and that's all driven by poor lifestyle choices, and that's the bit that we can control. Of course, this leads to rising healthcare costs. So we wanted to target the poor lifestyle choices, and that's where our wellbeing strategy comes in, looking at tackling those preventative wellbeing options with their employees before they get unwell, so that they make the right lifestyle choices to nudge them in the right journey. And why digital? Let's face it, we've just heard about how many people use their mobile phones, mobile banking in the last session. 76% of mobile users have a smartphone. That's going to rise to 82%. And more of a third of us use it for banking and mobile and online shopping. So why not use it for our healthcare journey as well and wellbeing? So a little bit about our benefits philosophy. There's two parts to it. So the core benefits side of it, we have health provision, and that's for all employees, death and service, which nobody wants to think about, and then, as we've just heard, saving for life, so pensions and making sure people are set up for their future. That's supported by voluntary benefits for individuals. So this is based on being cost effective, sustainable and consistent with our values. We've worked really hard with our benefits team to ensure that there's some wellbeing benefits in there. So we've cycle to work scheme, we've dental insurance, we've on-site health checks, we have a range of options that people can choose from. We brought this, so the first part of our digital journey was to bring this all onto one platform. So you want to make it easy for employees to access their benefits, know what they have. We also use single sign-on, so where it links out to third-party providers, that's just one click from this site. So that really helps employees find it all in one place. They don't care if it's wellbeing, they don't care if it's benefits, they just want it to be easy to use. So what's our wellbeing strategy based on? Well, we've got 3 pillars, circles, whatever we want to call them. Healthy body is what it says. It's all your physical side of things, so nutrition, exercise, sleep, helping people give up smoking, and alcohol awareness, which is always an interesting one. We did some on-site sessions where we got people to pour out their home measure of their alcohol, and then we put it into a units jar. They were quite shocked about what a home pour was in comparison to perhaps what you get in the pub. We also do synergy on-site massage, and as I said, we have on-site health checks as well for employees that are available. Healthy mind was probably a little bit harder to tackle, and initially it began around very much, we've got an employee assistance programme, everybody, that's enough. And we obviously had a proactive or a reactive occupational health service. So we decided, actually, we need to change this. We need to start creating awareness about mental health, destigmatising it. So we have a programme called Developing Mentally Healthy Workplaces. We run that for our managers and our staff association on a monthly basis. And what that's really done is change the conversation in the workplace. So for World Mental Health Day, we encouraged people to blog about their stories, and it was the busiest I'm going to call it online Facebook feed on activity that there had been in the workplace. So it really opened up the conversation and allowed people to talk. So we've really shifted the dial on that, definitely. And then healthy culture, that's all about bringing it together. So financial health, we'll hear a lot about that today. We have a financial wellbeing programme. Also, we have a range of networks. So employees come together and topics that are of interest of them, they get together and we support them financially through that. We have LGBT, we have women's development, we have a carers network. That then feeds into our policies and procedures and how those are reflected. So we recently introduced a carers leave policy, so up to 5 days, because we realise there's that sandwich generation that are having a squeeze between elderly parents and children. So that gives them some flexibility around that. We also have sports and social clubs, so you can be in the golf club or the mountaineering club or the choir. So it's a range of activities. I think there's a chess club as well. A range of activities which connect employees together. And I think that's a fundamental part of making sure that you've got that full vision and view on wellbeing. So how did we come together? So along with my reward colleagues, we decided that actually we were both trying to do the same thing, but with slightly different agendas. So we created a shared approach and began working together. A lot of that comes down to communication. So employees didn't get a communication about their benefits on Monday and about their well-being on Wednesday. We align it so that it comes out together and says the same message. We then had to think about our healthcare partners. So we were going out to market in 2016. And the core of what we wanted through that was to nail the basics. So we needed to make sure they met their service level agreements, that they had good customer service. We also know that people value, when they're unwell, getting the right clinical support, so that obviously was core. But I suppose where I played my part in it was I wanted the innovation. So where are we helping the population that are either healthy and want to stay healthy, or unhealthy but not unwell, and want to improve, and that's how we chose Cigna to go on our journey. So what are some of Cigna's innovations? They have 3 clear pathways at the minute, and they're constantly evolving. We have a cancer pathway, a mental health pathway, and a musculoskeletal pathway. And what that allows the employees to do is self-refer. So they don't have to go to their GP. If they've got an issue, they can phone direct to Cigna and be triaged to the appropriate support. It's a warm transfer if it's to somebody, a third partner provider. This gives the employee peace of mind. It's in line with clinical best practice, and I think ultimately the employer gets the benefits out of that because the person gets the intervention and the support that they need quickly. You'll see a picture of the app down in that corner. I'm not going to show you all the components of it, but there are several parts, so 6 parts to it. You have an online GP, online pharmacy, My Health Mate, which I will show you, and you have nutrition, so you get lots of support about recipes and impact of different foods on your mood. You've got the tech part, which is where you sync your devices, but there's a whole coaching area in there, so if you want to do exercise, if you want to do mindfulness, there's videos that you can link. It will put a program in place for you and it'll nudge you to keep doing them every Monday morning. Practice, keep doing it. So if we think about where this helps us in terms of a business, typically if somebody goes through the NHS pathway, they would visit their GP, which might take up to 2 weeks depending what part of the country you're in. But with Cigna you can phone direct. And that's same day, straight through to the nurse. That's available through the app, so if the employee's on the app, there's a button at the bottom that says Phone Cigna. Through the NHS, they might wait up to 30 days for a CBT appointment. On average, it's within 10 days with Cigna. So again, you have a potential cost saving as an employer of 20 days to get that support. That helps the employee, quick intervention, and cost savings for the business. So I'm now going to take you through a journey of the app. So if we use Paul, he's got some health concerns, so he logs onto his app. It's all secure with your own ID and your own password. It's personalised, so that's where we're creating that personalised journey. He's got some concerns, so he logs on. He's not that unwell that he thinks he needs a GP appointment, so he starts to explore what else is available to him, and he decides to look at My Health Mate section. In My Health Mate, what this does is lets him complete a health risk assessment, so we'll have heard various options, answering a range of questions around nutrition, physical activity, stress levels, sleep, lifestyle, and your underlying medical conditions, which of course gives him a score, and he can learn more about his health. It will then also tailor advice to him based on what information he's put in there. On this occasion, stress. And we've heard lots about that today. High levels, it's a worrying result, shows him some cause for concern. He's thinking, what do I do? Is that to the GP, or should I phone for some support? On this occasion, he decides again, straight from the app, to call through to the Cigna nurse. They discuss his concerns and what would be the best course of treatment. And again, we've interlinked this with their employee assistance provision, so they can be referred to that if that's the most appropriate support. We also have Cigna's Living Life to the Full, which is like an online CBT module that they could be directed to, or depending on severity, straight through to psychotherapy and psychiatric care. Paul's quite proactive, so he's also thinking about exploring mindfulness. So he logs on, finds the information about coaching that's been recommended, as part of his stress risk assessment, and he can do this at a time that suits him, in a way that suits him, in a place that suits him. So we're not always driven by, has to be in the office for the mindfulness session at lunchtime. He can do it in his own time, his own location, and with his own support, and put that diary, and it will nudge him to take the right activities. So how have we driven this engagement for Standard Life? So when we changed provider, we initially teased people and said, look what's coming. You've got this wonderful app as part of your private medical cover. Here's all the components of it. I'm just going to find my numbers. We then did some on-site activity, and I suppose this comes back to the personalised. You can't do it all digital. Sometimes people want to talk to people. So Cigna came on site. We had, I'm going to say a giant iPad, but I believe it's a TV turned on its side, which people can interact with. So they were able to press the buttons, explore what was available to them. They still didn't have access to it at this point, so this was warming them up to it, and then we launched it. What we got by the end of that month was 450 users, which out of a population of about 5,000, I'd say we were quickly disappointed with. But in terms of actual uptake on new products, this was deemed quite good. We had 270 registrations for the GP, and over 2,000 employees registered on the member portal. So overall, not a bad start, but it couldn't end there. So we had to keep drip feeding our employees with various different mechanisms. So each month we'd started to introduce the different parts of the app to them, meet their virtual health team and take them through the different parts of it so that they got to explore the different components. We then linked that to other things that we do in our wellbeing programme. So Mental Health Week in May, we made sure that we tailored that we were sending out the appropriate Cigna advice at the same time. And again, that increases engagement because if you've got on-site activities, you've got the online activities, they're getting the emails, it brought it all together. Then in June, we decided we would do the health risk assessment email. So quite a low uptake on that, but what we did was supported that with on-site health risk assessment, so know your numbers. We got over think it was 300 on-site assessments. So individuals got their numbers and then they were encouraged to go to the app and put that in, which gives them more rich information and outputs. So where are we now? So we're a year and a half in. We have over 1,500 app users, so we continue to see engagement increasing each time we do a new campaign or launch a new area to it. 914 GP registrations, so people value being able to get the GP, and over 3,500 members are registered on the portal. So again, it's a journey. It needs lots of work, needs joint working, but we're getting there. So what are we going to do with this? We're very much at the early engagement stage, so looking at how many people are using it, how many calls we have, and how many GP consultations. The aim is to encourage behaviour change, so in the midterm, start to get more insight into employees' health, use that data that they put in through the health risk assessments, obviously all anonymised, to show us where our problem areas is and what we should be targeting. And then in the long term, hopefully you will see the impact on absence and medical claim costs. Interestingly, so far our CBT usage has increased month on month, and we see a big spike in it when we do a mental health campaign at work. But that's good. I'm not from the reward side, I'm from the wellbeing side. I go, this is brilliant, people are getting the right support at the right time, and they're getting early intervention, so that lower level. So that's really good. And what we'll use that to do is inform our wellbeing strategy as we go forward. It's very much a joint journey between all of us, our partner Cigna as well. So we've got the basics of the private medical plan. We've got the app, and where we want to go is there further service integration that we can do. So our occupational health provision, getting the biometrics directly fed into the app so that people don't actually have to go and do it if we get the on-site checks. And that's the innovation that we want to continue to work with Cigna to build on. So what role has digital got to do? Well, if you invest in that prevention, so we're not waiting till they're unwell, drive engagement, use the data to measure the success, you're going to save really on the diagnosis and treatment and hopefully your medical care plan. As I say, it's not a huge cost, but slightly going up the more you promote, but we have to expect that as people try and get healthier, it's a long-term game. And that's me. If there's any questions, either through the app or I'm willing to take them directly. Okay. Yes, the app, if the member or employee has bought the provision, so they get it directly from the employer, if they have bought the provision for their employee, their family, they can use it, although I think they have to be over 18. They have to be over 18, yeah, over 18 to use it. Regarding the launch of the app, what would I do differently? Probably more on site, so more of that reinforcement, more of that visibility of being, so it's one thing emailing everybody, but actually being able to interact with it and play with it and ask questions. I think more on-site activity at that launch stage would definitely help. Anything else? Anybody, any in the room they want to ask? Yeah? The app is part of the provision, yeah. So it's the preventative part of the full provision, yeah. Although you can always talk to Cigna about whether you can buy it separately. Anything else? Oh. You've got 1 minute back, which means you'll be straight out to the buffet before everybody else. Thank you.